We were charged by the Office of the National Coordinator for Health Information Technology to create a modified version of a large data lookup program that is used by the Indiana Network for Patient Care to look up data within the INPC network. The INPC is a consortium of 103 hospitals, in addition to nursing homes and Indiana Medicaid and other insurers, et cetera, that all share data by providing them to a common database. And to give you an idea of the size, it was the first health information exchange in the country, starting back in 1987. It has 103 of the 120 or so hospitals in Indiana, and it has 15 million patients and 6 billion observations in it that go back 40 years. It's a large, comprehensive data repository that is used by clinicians in the health systems that are contributing data to it, so they can look at data that happens both within their own network but also outside of their particular network. My institute, the Regenstrief Institute, wrote the software and implemented the software that is used by all of the INPC institutions to look data up. And so since it's our system, we can fiddle with it. And so we were paid to modify it to do two things. Number one is to record patients' preferences on who can see what in their electronic health records. So first of all, we had an all or none capability. So you can say, I want everybody to see all the data in I want everybody to see all the data in my record, period. So it's wide open, okay? Of course, they have to have access to the system, but once they enter the user ID and password and enter my record number, then all of the data that are in the system are available to look up. There's the none phenomenon, which is I don't want anybody to see anything. I want my data hidden from everybody. I just don't want anybody to see what's in my record. It's personal to me and I don't want anybody to see it. But then we provided what we call more granular control. So we identified the sensitive categories of data that I mentioned before: mental health, reproductive health, substance use, sexually transmitted infections. And we allowed patients to say, of each one of those categories, did they want to hide those data from either from everybody or from certain healthcare providers, or provide access to certain healthcare providers. So somebody could say, you know, I only want my primary care provider and my regular nurse to see everybody can see everything but my mental health data. I want my mental health data to be visible just by my primary care provider and nobody else. And then I want to record that. So we set up a system that patients could record their preferences for viewing data based on the kind of data, the kind of person, and also by dates. So you can say, I don't want anybody to see anything that happened before I was 16. I was dumb before 16, and I did some dumb things in my record. I don't want anybody to see them. And the second thing we did, besides asking for those preferences, is we actually invoked them. We created a system in the data viewer for the INPC. The data viewer is called CareWeb. So we modified CareWeb so that if somebody had recorded their preferences for who can see what in their record, it actually implemented them. So if it said only my primary care provider can see my mental health information, then if I'm your primary care provider, I can see your mental health information, your visits to mental health, the psychiatric drugs that you're taking, emergency room visits for mental health diagnoses and things like that. All that information is available to me. But if you said nobody else, then if I were somebody else and nobody record, all that information would just not be shown. And it wouldn't say that it's hidden. Because if I say mental health information is hidden, well then you know there's some mental health problem the patient has that the patient's not telling you about. And so we hid the information. We didn't hid it, we just didn't display it. And no indication that nothing was being withheld.